collectively working to raise awareness around concussion because 1 in 2 people who have a head injury do not seek medical attention. And so together we're really working to change that narrative and to really increase the awareness of folks that it is important to seek medical attention if you sustain a head injury, and that concussions are serious and need to be addressed. And so we are getting ready to recognize National Concussion Awareness Day, which is coming up this week on Friday, September 20th. And the theme of our campaign this year is Start the Concussion Conversation. And so I will be glad to share a little bit more about some of our tools and resources later in our conversation. But I just wanted to share that we're just thrilled to have you, Emily, to join us because we are hosting this concussion conversation today to really talk about the connection between concussion and falls. I think that in both of our work, we manage a lot of kind of misconceptions about concussions and about falls, right? And so I think today it would be great for us to work together to just share a little bit about those myths and facts and realities. So just to get us started, just from our perspective at CAN, a lot of people think that athletes are the most, at risk for concussions. But research that the coalition did shows that athletes are not, the most at risk, and they're only, a low percentage of ER visits are, associated with athletic related concussions. And so in reality, the most common scenario for sustaining a concussion is in everyday kind of situations, slips, falls, those, tripping on things, that sort of thing. And falls are the number one cause of concussion. And I know that NCOA does a lot of work around falls and falls prevention. So can you tell us a little bit about, how falls and falls prevention is addressed at your organization at NCOA?
Sure. Thank you. The National Council on Aging, or NCOA, we're the national voice for everyone's right to age well. And we work with national and local partners, including CAN, to provide tools, best practices, and advocacy to ensure every person can age with health and financial security. NCOA's Center for Healthy Aging supports a variety of evidence-based health promotion and disease prevention programs. And with funding from the Administration for Community Living, we serve as the National Falls Prevention Resource Center. And so we work to increase public awareness about falls and injury prevention. And we serve as the national clearinghouse for tools related to falls prevention for consumers and professionals. And we'll be putting the link in the chat.
Great. That's great. Thank you. How prevalent are falls among older adults?
Quite prevalent. I think most of us know someone who's experienced a fall, or we've fallen ourselves. So 1 in 4 Americans age 65 and older experiences a fall. Falls are quite common, and that's why we take action to spread the word about simple steps to prevent falls.
Yeah, I think that's so important. What are some of those steps that people can take to prevent falls?
Sure. There are a lot, but I will give you the highlights. We encourage people to talk with their healthcare provider, especially after you've fallen, to ask for a falls assessment to learn about your individual risk for falling. We recommend that you get your medications checked by your doctor or pharmacist. Some medications can have side effects or interactions like dizziness that increase the risk of falls and concussions. Another important step is finding a physical activity program to maintain or improve your strength, flexibility, balance, and endurance. And you can go to eldercarelocator.org. We have a link for it, and it also includes a phone number if you prefer to call. and they can find programs near you. They can direct you to programs near you that can help. And physical activity, you don't have to participate in a group program if that's
Mhm.
not your style. Walking is physical activity, or gardening. It really helps to do something you enjoy. Then just a couple more, make simple changes to your home to increase safety and support. A nightlight can reduce the risk of falls when walking to the bathroom in the dark. Even something as simple as keeping frequently used items within reach can reduce the need to bend down or reach up high and potentially lose your balance. And a lot of these changes can also just make your daily activities easier. And then getting your hearing and vision checked annually, or if you experience changes. And taking these steps to lower the risk of falling also help to lower the risk of sustaining a concussion.
Yes, that's such a great point. I was really honored to be able to attend earlier this year the NCOA's conference back in May, and so it was great to connect with your community and stakeholders. And we were able, Concussion Awareness Now and NCOA, we worked together to develop this great resource that I just wanted to plug, and we can share it in the chat as well. But it's called "Get the Facts on Concussions on Falls," because I think it's really important to just elevate that there is that strong connection with, falling and concussions, and falls being the number one cause of concussion. So if we can mitigate the risk of falling, you can also mitigate the risk of sustaining a concussion. And I think that, just kind of to your point, there's just so many great tips and suggestions for how to, how to think about taking those precautions. But I think also, like, talking about if somebody does fall and they hit their head, for us, we always talk with folks about, that concussions are invisible injuries, right? They're not the same thing as broken bones, where you might see that there's something wrong visibly. Symptoms may, can vary, and they might not appear right away. And so, I think, just can you talk a little bit about, like, what you would advise as far as, seeking medical attention? Because certainly, I think we both, would advise that it's important to get checked, right? And seek medical care. But from our research, from Concussion Awareness Now, many people don't feel that their symptoms are severe enough to need medical attention to seek out going to the doctor. But we really want to change that, right? And let people know that it's important to get checked. So do you have any comments around that, from your perspective working at NCOA and medical attention?
Yeah, absolutely. And I think there are a lot of parallels with reluctance to talk to your doctor after hitting your head related to a potential concussion, and talking with your reluctance about talking with a doctor after a fall. But seeking medical care, it's extremely important. If you experience a fall and hit your head, like what you said, even if you have no symptoms, it's important to get it checked out. There could be an internal head injury that's not visible. So a health professional can determine if you need follow-up care and ensure that you get the care that you need. And falling once doubles your chances of falling again. So also, speaking with a health professional can help you learn about what might have caused the fall, and then identify ways to reduce your risk of future falls.
Yeah, that's. Oh, go ahead.
Yeah, and I think some reasons for this reluctance include, like, fear of losing independence, being a burden on others, or due to financial considerations. But really, if you don't seek medical care after a fall and something comes up later, it could be a more serious problem. So yeah, just
Yeah.
reiterating the importance of getting it checked out.
Yeah, and I think too, sometimes concussion symptoms may may look like signs of typical aging, right? If there are things like dizziness, confusion, like vision sorts of considerations, um, could they be mistaken as nothing to worry about, right? Because
Absolutely.
they're written off. Um, so yeah, so certainly I think just the importance of reassuring people that it's important to, to get medical care if there's any suspicion of, of a concussion is super important. Um, and I think that, from your perspective, there's also you shared some resources too around how people can learn more about falls. Do you want to elaborate on any of those resources?
Yeah, sure. I'd be happy to. And to find them, you can go to ncoa.org/falls prevention. We have a wealth of resources on our website, many of them designed for professionals and many designed for consumers. One very popular product, it's a resource that can be a handout, but it also comes in video format, is our 6 steps to prevent a fall. And it kind of boils down the most essential information that we want to communicate to people about ways to reduce fall risk. We also have the falls free checkup tool, and that is available on our website. It's a 13-question tool that an individual can answer the questions on their own, or with a caregiver or a loved one can do it on their individual's behalf. And it helps to identify your level of falls risk. It includes some recommendations and links to more information. And it also gives you the option to email your falls risk assessment to your doctor or healthcare professional, and you can email the report that's generated to yourself as well.
That's
Both
great.
of those are available in English and Spanish. Um, and we have home safety checklists. We have a caregiver discussion guide about falls prevention, because sometimes starting that discussion can be a little difficult. So I encourage you all, if you're interested, to check out those resources and many more on our website.
That's great. Thank you, Emily. And I also wanted to share so CAN is co-chaired by Brain Injury Association of America and Abbott. And so from the Brain Injury Association of America, there's also the National Brain Injury Information Resource Center. So we're happy to share that link in the chat as well. So for anyone that might be interested in connecting with a specialist for more information on brain injury, and concussion related questions, we're happy to share that resource as well. So I think that we've talked a lot about like the issue and how falls are connected to concussion and the importance of paying attention, to this issue. And I think that both of us at Concussion Awareness Now and NCOA have some awareness campaigns and calls to action, opportunities to get involved coming up. So I wanted to spend a few minutes sharing about those. So just really quickly, National Concussion Awareness Day is coming up on Friday, September 20th. So the Concussion Awareness Now Coalition is really hosting a public awareness campaign to invite champions and awareness supporters to start the conversation around concussion. We have a lot of different tools and resources to do this available on our website. So I would encourage you to look at our resources and see how you can use them. You can take action in your community online, offline, or a combination of both. So there's really opportunities to start the conversation with individuals like family, friends, a teacher, a coach, a coworker, all the way, through planning a public awareness event, having a table or a booth at a community activity, hosting a presentation. We have a presentation template available. So there's lots of resources to help you where you are interested in raising awareness. So definitely encourage you to check that out. And then join us at our webinar, which is on Friday, the day of National Concussion Awareness Day at 2 p.m. Eastern. And so we are having a champion rally where we'll be sharing great ideas from champions across the country of what they're doing to get involved and how they're starting the concussion conversation. And we're also going to be joined by Dr. Brooke Mills, who's the founder of National Concussion Awareness Day, and talk with her a little bit more about the history and her experience with starting that up. So lots of exciting activities coming up through CAN. But there's also a really exciting campaign coming up right after the Concussion Awareness Day that NCOA is hosting. So Emily, I would love for you to share a bit more about your falls prevention campaign that people can get involved in.
Thank you. Yes, NCOA has been very busy. We have put together a number of resources to support and recognize Falls Prevention Awareness Week. This is an annual initiative that we recognize during the first week of fall each year. And state falls prevention coalitions, community-based organizations, healthcare agencies, et cetera, across the country hold presentations, do program demonstrations, health fairs, advocacy with their mayors and governors, and a whole host of different activities to raise awareness about the issue of falls. NCOA has a toolkit, FPAW, or Falls Prevention Awareness Week toolkit, and it includes impact reports. These are reports of what groups did last year and in previous years to recognize Falls Prevention Awareness Week, and it has some great ideas in there. We also provide social media content, videos and handouts, also guidance on advocacy efforts and public relations, and more. So I think we have the link to put in the chat. And if you'd like to learn more about what might be going on in your state or community, I recommend checking with your state falls prevention coalition, and you may have local coalitions as well. NCOA has information on our website about the various state falls prevention coalitions. Almost every state has one. And we have a list of contact information for each coalition. So I recommend that you follow up to learn more about what might be going on in your community. And if I didn't already say it, Falls Prevention Awareness Week is next week. So the first week of fall, 23rd through the 27th.
That's great. Yeah, I think that there's so many different opportunities to get involved, and to use your voice to just spread the message, right? And I think that that's true for all of the work that we're collectively doing is just to get the message out there, and then I think everyone can contribute in a way that makes sense to them, and I did want to say that, the sheet I referenced before, they get the facts on concussions and falls, that is part of our toolkit on the CAN website as well. So if you are listening in today and have a particular interest in the intersection of concussions and falls specifically, that's a great resource and a great tool that you can use in your awareness efforts as well. And I believe it's also in the NCOA's toolkit. So we work together on that one, which is a great experience. And certainly within the Concussion Awareness Now toolkit, just to echo, what you were saying, Emily, we have a lot of different social media posts, that people can just copy and share. So it makes it really easy to be able to spread the word. but definitely, check them out. We have infographics, posters, downloadable resources. We do have a myths and facts about concussion resource, and it includes on the back, there's a quiz that you can give to, if you're doing a presentation, if you're just talking one-on-one, you can give the person a quiz, and it goes over a lot of those myths and facts and kind of misconceptions about concussion, just to get the conversation started. And I think that, often through having conversations like we're having, and with other people, it often will spark interest in, people saying, well, I didn't realize that, I didn't know that was, the case. And so I think that's, just an important consideration for all of the work that we're trying to do, is just to spread the word about the realities of these issues. And really just get people educated and interested in supporting, and supporting the cause. And if we, talk to one person and they talk to another 5 people, then that's, it just has a ripple effect. And so, just great opportunities, and NCOA does such a great job, with all of your work. So definitely looking forward to seeing your campaign unfold later this month.
Great, thank you.
Sure. I am welcoming people to put any questions in the chat if there's anything else that we can address through our conversation today. If not, we're happy to just put some links in the chat for your review later. But I do want to share that information about the coalition. You can find more about the coalition and our work on our Concussion Awareness Now website, which will be in the chat for you. You can learn more about our partners. As I said before, CAN is co-chaired by BIAA, Brain Injury Association of America, and Abbott, and NCOA is one of our members of the coalition. So for a full list of that and more about our work, feel free to head to our website. And I just wanted to, again, Emily, just thank you so much for spending time with us today.
It's been my pleasure. And yeah, we very much enjoy partnering with you. So thanks so much for having me.
This is great. Thanks, Emily. Thanks, everybody, for joining our concussion conversation. And we will see you again soon. Thank you.